This is something that did not happen during COVID. It was all ivory tower science, and the doctors who were on the ground were ignored. The same thing happened during the HIV crisis.
Yes.
And we're trying to do something different, which
So
is
my
really
time's limited. You mentioned ivory tower. And so that's a segue into a statistic that I've become familiar with over the years. It takes roughly 18 years for proven interventions, pharmacological or other types of medical interventions, to make their way out into the field. If we assume, I think a conservative estimate, 12 to 15 years until we have any really acceptable therapeutics for a long COVID, that's a cheerful estimate. Plus the 18 years until it finds its way into clinical practice, people roughly my age will pass. Actuarially speaking, they will pass before there's any acceptable therapeutics. So we need to accelerate our current activities. Can you give me a couple of things you're going to do to ensure that we accelerate our development of therapeutics?
I mean, the best solution is the same kind of solutions that we should have been pursuing during COVID, which is off-the-shelf approved drugs for that are there already.
Yes.
So you don't have
it was
to go
recently
through
reported that all the major pharma companies, I'm sorry if there's one good student exception, are serving as barriers to clinical trials. That is, how can they repurpose?
It is bizarre that that's happening.
Okay, you're the Secretary of HHS. Will you be cracking down on this lack of cooperation?
Yes.
Thank you.
Yes.
Thank you so much. Will you also be exploring research partnerships with other countries, seeing as I've established this is a global challenge?
Yes.
Okay.
And that's what we should have done during HIV. It's what we should have done during COVID.
Yes.